Welcome, everyone. This is the Rotary eClub of Silicon Valley. Every week, we are working to bring you the stories of people working to make a difference in the world. We're part of Rotary International, a group of almost 1.2 million people in 36,000 clubs globally who live by the motto, service above self. Our particular club is focused on things such as education, innovation, and entrepreneurship, and how that may be important for what our communities locally and globally may see as a particular need. So in the space of education, we are looking at some very important issues today related to mental illness. You have learned a little bit about our speakers, Lauren and Teresa, as you came into this one. Reading their bios coming in, they are both parents and family members of those who have battled a variety of challenges, and they have stepped up in a way to make conditions better for them and for all who see similar challenges in their lives. I am excited for them to be here. I want to thank Paul, whom I'll introduce later, for helping connect us. And with that, I would like to say, Teresa and Lauren, the mic is yours. Thank you for taking your time to present to us today.
Wonderful. Thanks so much. Can we have the next slide, please? So I am honored. It's an honor to join you all today. Lauren and I welcome these crucial conversations that, in order to share learning and system solutions. I'm going to start by telling you a little bit about my personal experience with the California mental health system in order to help you understand what drives my passion. I am the proud mom of an adult son who lives heroically with serious mental illness. He was diagnosed in his teens and has spent the majority of his adult life in locked psychiatric facilities. When I carried him up the stairs the day of his homecoming, I never dreamt that he would be forced to go through so many wrong doors in his life. Locked psychiatric hospital doors, jail doors, courtroom doors, and homeless shelter doors. Until recently, there's been absolutely nothing civil or right about my son's care. The past 20 years have been a blur of suicide attempts, over 40 involuntary holds, revolving hospitalizations, and incarceration. He was actually arrested as a patient. We had resources, insurance, and my full-time ability to navigate the maze of services in one of the most integrated healthcare systems in our country, but it was still a nightmare. So I began learning about all the systems that were designed to keep my son from healing or living close to us. I learned early on that the only control I had was over my voice and our family story. I joined every local, state, and national forum to shatter silence, shame, and the status quo. And today, Lauren and I want to highlight a few things that moms know and families know. Things that the average person doesn't know about families like mine, yours, and ours. For those who live in communities that are overcome by homeless encampments, they often don't understand that every person living on the streets is part of a family. They don't understand what drove these people to homelessness and what prevents the family from rescuing them from the streets. But Lauren and I understand because we have watched our sons become lost in the human and fiscal shell game of the California mental health system. We partnered up because we wanted to shatter the myth that moms like us just want to lock up our seriously mentally ill adult children and throw away the key. We wanted to show that it is the system actually that is designed to lock them up, either in solitary cells, institutions of mental disease, or their untreated minds on skid rows. And we wanted to search for the key that would open doors for healing homes. So in 2019, we went on a 3,000-mile road trip, the Housing That Heals journey, and we went in search of a place like home for families like ours. And our Housing That Heals paper defined the drivers of despair and disparity with both system data and what we call data of the soul, which is our lived experience in trying to save our sons and families from falling off every carved out cliff of California's continuum of care. Next slide, please. So this is actually a picture I took off a freeway exit in Berkeley. And it kind of demonstrates that what for decades, families, thousands of families have been trying to build housing that will save our loved ones from living on the streets, living in jails or in grim care homes with untrained staff. The status quo forces our loved ones and families to suffer needlessly, and our communities suffer also. Nobody can defend the status quo. The purpose of our Housing That Heals mission is to change the narrative and to shatter the status quo by, number one, defining the problem and the forgotten population. Two, sharing solutions and strategies to reform systems. Three, educating and advocating for a shared action plan that will start building more housing that heals in order to stop street suffering. So this is a phrase I learned when I was studying system redesign. Every system is perfectly designed to get the results it gets. And I believe the California mental health system was designed for families like mine to shoulder the weight of caring for our loved ones without adequate support. The California system was purposely designed this way to save money, but it was a flawed design that has cost us all so much. The Housing That Heals concept is a strategy to redesign the system that will save money, improve quality of life, and produce better health outcomes for those who live with serious brain disorders known as SMI. All California communities must recognize that some people who live with a serious mental illness need more than a Housing First program, and frankly, more than a room key. First, they need a system that cares and catches them before they fall off the cliff. A healthcare system that includes a tiered array of housing that heals as part of a full continuum of psychiatric care will prevent our loved ones from falling off the cliffs and prevent our families from falling off with them. Lauren and I spent 12 months traveling across California. We found that there is no lack of information about the current humanitarian crisis due to the inadequate supply of psychiatric acute beds, IMD beds, or board and care beds in California for the SMI population. We found that it's actually no longer a secret that our county jails are the largest providers of mental health care and service because they are the beds that never say no. And we found extraordinary community discussions and investigative reporting that have brought awareness to the clogs and bottlenecks occurring due to the lack of a continuum of psychiatric care. And our paper refers to this phenomenon as a human logjam because it's actually human beings that are being impacted, not widgets in a machine or parts in an assembly line. We found that there are huge gaps in accessing appropriate step-down beds. They are scarce, underfunded, and disappearing. And we believe we must move from scarcity to abundance if we are going to bend the human logjam on our streets, in our jails, and in elderly parents' homes. We must move mountains and redesign our systems together. We must focus both on the unsheltered homeless and the at risk of homeless SMI population who cannot live independently. First, we need a right to treatment before we force anyone with a serious mental illness to fail first, live unsheltered first, go hungry first, suffer needlessly first, and possibly die.
We would like to give you some highlights of our Moms on a Mission tour, from the most restrictive to a least restrictive option. Our paper gives many more examples and a more in-depth continuum of care. Today, we will show you the housing options that are in most need of replication for those who are the most seriously ill. In order to know if a housing program is healing, it must have the ability to continuously connect to a system of care that meets the Institute of Medicine's 6 quality aims. There must be equal standards of care for physical illnesses and brain illnesses. They must be based on both science and a family standard of care. Housing That Heals wants more than an open bed. It wants a home and a community for loved ones. California Psychiatric Transitions is a 98-bed, fully licensed mental health rehabilitation center the equivalent of an Institute of Mental Disease, commonly referred to as an IMD. It is not a state or county facility. Instead, it is privately owned and contracts with many California counties who need a secured treatment and housing placement. The program is highly structured in a tiered system and is a step down from the hospitalization at a state hospital. Clients must attend groups based on treatment plan goals. The highest level of clinical and staffing support is provided. Off-site recreation and social activities are offered as appropriate. For 20 years, Teresa's Danny and his family endured several acute hospital stays. 2 state hospitals, many IMDs, and both small and large board and care facilities. However, none were as successful as California psychiatric transitions. This is a treatment center that prepares people to enter an unsecured facility in a community setting. Synergy is just one of these community-based residential treatment facilities with direct access to a specialty mental health clinic located next door. This allows psychiatric treatment to access federal reimbursement through Medicaid and the Medicare system. Residents have the ability to come from a locked facility and move from a shared room to living in an apartment on site. Synergy was designed to be a treatment center, not a permanent residence. However, it may be home for some people for a few years. Synergy provides a team of licensed therapists, farm-to-table meals, personalized exercise plans, and equine therapy. It allows individuals to move out of secured locked settings and into successful community living. When one enters any of the 4 Synergy campuses, one does not get the sense of an institution. The grounds and common areas provide a beautiful place where a person can sit and be with friends. Synergy knows that rejoining the community is an important step to wellness. Both Synergy and California Psychiatric Transitions do not have nonprofit status. Our desire to learn more about the John Henry Foundation was a spark that ignited our Moms on a Mission tour. Here, residents find a home in a community that is surrounded by a larger community, yet provides the support needed to participate fully in life. One must have a diagnosis on the schizophrenic spectrum to live here. It is a private nonprofit. To say we were amazed at the quality of life and the stability of life here is an understatement. In California, the full-service partnerships that use the scattered site housing first model may lower the number of times an individual needs hospitalization, but what is the quality of life like for those who need to be surrounded by daily supportive services and people who can easily interact with them? Would it be possible to create programs like this in our public system? The yearly charge for someone to stay here is $42,000 a year. In California, the cost to keep someone on the street is $41,000 a year. To keep someone incarcerated, it is $81,000 a year. Seeing the cost effectiveness of this program, we do not understand why there are not many more communities like this. Not only did we travel across California, we also traveled across the country to attend Treatment Advocacy Center's first assisted outpatient treatment symposium in Ohio. We have presented our paper to multiple National Alliance on Mental Illness affiliates, known as NAMI, across the state, and are due to present to the NAMI Santa Clara General Meeting in June. Off to you, Teresa.
So you've seen where we've been, and now we are wondering where are we going? Where are we going as a state, as a country, as you know, as a nation, and as a world, really. Our Housing That Heals Heart paper asks state and local leaders and our community partners to help families like ours and communities like ours do better for this small population that has historically been forgotten. While the state rightfully focuses on racial and other health disparities, we must not forget the population that is considered the greatest health disparity. According to the National Council of Behavioral Health, quote, people with serious mental illnesses die an average of 15 to 30 years younger than those without. This difference represents the largest health disparity in the US, larger than gender, racial, or socioeconomic differences. And unlike some of the other gaps that are slowly closing, this one isn't shrinking, end quote. We can't be the forgotten population anymore. We really must all come together to scale up common sense and build housing that heals on common ground. Next slide, please. So there are broken-hearted families like ours all across this country and state in search of a place like home for their loved ones. Other moms are afraid of dying, leaving their SMI loved ones without adequate support and care. Our families have actually been carrying and sharing the weight of the burden with the broken barriers, bureaucratic barriers to a continuum of care, along with our seriously mentally ill loved ones. And we really don't want anyone, anywhere, anytime to be denied access to the right door. But without access to both medically necessary and recovery-based services, the human logjam will grow and our loved ones will continuously cycle through the wrong doors. So together we must all continuously reimagine our mental health systems in order to create the community coalitions where Housing That Heals plan of action can be built together. We have seen it happen and we know it's possible. Thank you.
Thank you so much, Teresa and Lauren. I'll take a moment to introduce the group that we have with us, and then we can get into some questions about these topics. First, in addition to our speakers, Teresa Pasquini and Laura Rettagliata, I'd like to welcome guest Paul Bohm. Paul, thank you as always for the connections that allowed us to bring such important topics to our group. From our membership, we have our Paella Master, Shag Shagrin in Walnut Creek. We have in Texas, retired judge, Rory Olson. And we have one of our newest members of the Rotary eClub of Silicon Valley. He also here in California, for Abdullah. All right, my name is Rushton Hurley. I am very happy that you have joined us for this talk, and we'll send the first question to Afra.
Hi, thank you so much. That was powerful and it was moving. It hits close to home for me as well. My stepmother has a schizophrenic brother that she's been caring for about 18 years. And it's a serious, serious undertaking that impacts everyone around the family. So it's amazing to hear about a home like this that provides the quality care that you would want for a loved one. What I'm wondering about is accessibility to these kinds of homes. Like, how are they readily available? Are there many? Do we need to push for a whole lot more of them? What do the numbers look like?
So I'll take that first. Thank you for sharing your story. And I also have a sibling. My older brother also has a serious mental illness, and first defining memory of dealing with that was when he jumped off the Richmond-San Rafael Bridge and survived with a broken back. And so I have about a 45-year history with dealing with our state's mental health system. And my brother actually was able to go on and get the help he needed because there was access. This was back in the 70s, and there were many more beds available, hospital beds. There was more access to care. And so when my son was diagnosed, I thought, okay, well, I know what this is, and I know what to do. We'll do like we did with my brother. And it was a different world. It was a different system than what my family had experienced with our brother. And it was a different person because you can't put everybody, into the cookie cutter system. So to answer your question, access is very, very difficult, and it's virtually impossible for families like mine to reach a hospital bed, a psychiatric hospital bed when needed. even if you want one voluntarily, it's almost, impossible to get through the front door. And there's, as I mentioned, there's jail beds available 24/7. They never say no, but psychiatric hospital beds have disappeared since the closing, the closing of our state hospitals many years back. And the system, the community system that was supposed to be created wasn't completed. And even though California has all kinds of money, we had the Prop 63, the Mental Health Services Act dollars, and it's a siloed funding stream and has not been able to provide the services that are often needed. So access is not easy, and it's one of the reasons we wanted to go on this trip. I happen to have the privilege of being a stay-at-home mom and having my full-time ability to navigate the system. And I'm from a privileged family of, my husband, worked and allowed me to be home so that I could navigate and fight for our son. But eventually we had to drop his private insurance in order to get him a bed into CPT, which is one of the slides that you just saw. And because they would only take somebody who was conserved and only had Medi-Cal. Danny had both. So we are committed, Lauren and I are committed that whatever is available to our sons is available to all. And that was a commitment we made on our Housing That Heals journey. And anything we saw, we believe can be scaled up and can be replicated and offered to anyone, anytime, anywhere.
Thank you, Teresa. Paul, you have a question.
Okay, so thank you, Teresa and Lauren. I've told you many times how much I admire you both, and your presentation was so informative, and you have so much information, but it's more than information. You're sharing your heart, and so we appreciate you being here today. Thank you. And I want to make reference to Michael Gray and Elizabeth Hank, who also presented for this eClub and presented on the topic of mental health, and many of the topics that you shared today were also brought up at that time. So where do we go next? What can this eClub do that would make a difference? How can you, what kinds of steps would you consider something we could do that to help in this effort?
Paul, thank you for that question. And there are different, we know what to do in California, but what we do in California can be used throughout the country and also in other nations. And that is that you have to become part of the political process. And the political process is not a bad thing. The political process means that we, the people, get involved and we let the people that we've elected know what needs to be done. And if they are taking wrong turns, like they are many times with mental illness, that we let them know about that. I know in Santa Clara County, you have an discussion going on now about assisted outpatient treatment. And assisted outpatient treatment is something that can help a fraction of the people, not everyone, but just a fraction of the people stay in the community. And everyone wants people out of institutions and in the community if they can be in the community. What Teresa and I found many times, and what I think we all have to enlighten our politicians and the people who make the decisions that where the dollars flow, is that many people still need what is considered the medical model. They still need at times to have intensive supportive services to be there. And they are so ill that they can't answer the door. So if they're out in scattered housing and someone from behavioral health comes knocking on their door, they are so sick they can't even get out of bed to answer that door. So what we have to do is we have to make sure that people, when they need medical intervention, have the medical intervention that they need. And that is why we showed you the 3 places we showed you, because they have intensive support systems built into them, where it would be very hard for someone to lock themselves away and not get the treatment they needed. People seek the street because they feel accepted there. They want the dignity and the acceptance of the community, and that's a community where they feel they're accepted. We have to make our world a place where people with a severe mental illness are shown the dignity and the respect that they need to fight this illness that they have, that they are in need of support of.
Thank you, Lauren.
Yeah.
Can I ask one follow-up question?
Go ahead.
Yeah. So on May 25th, the Board of Supervisors of Santa Clara County will be voting on the topic of Laura's Law, whether to adopt it. I've heard that it's really critical to have a judge involved in the process. Can you talk to that a little bit? How can we encourage our supervisors to vote the right way?
I think it's imperative that you do. I think that you can show them that the counties that are having the most success have the judge involved from the very beginning. And the judge is involved as someone who helps not only the provider of the service, but also the person that's receiving the service. My son has been in assisted outpatient treatment for 2 years, and he does not answer the door. He is not receiving the treatment that he needs. And that's because our county did not put in the need for the assist from the judicial aspect of this program from the very, very beginning. This is essential, along with housing that heals. When you place people out in the community and allow them to close the door and not answer the door, they're not many times, because of their illness, the severity of their illness, they don't answer the door. They don't receive the treatment they need. And we've got to get the judge in there from the beginning, getting the clinicians to them that they need to have to get well.
Thank you.
Before we wind down, Shags, I believe you have a comment.
Yeah, my wife's a pharmacist, and she said that a lot of these things started, the problem started when the medications came out that brought people to a more treatable level, yet they closed the hospitals. They closed the facilities for the treatment because it was no longer needed. And that's really not true. People don't take their meds. They don't follow the protocol because they're mentally challenged. And from an internal perspective, hey, everything's fine. This is my world to me.
Right.
Medications make them feel as if they're not themselves. And so it really needs to go back to a hands-on treatment, and as you're talking about. So I honor and commend you for that.
Thank you so much. You know, I do have a beloved son who has struggled, obviously, for many years. And, I will say that, he fought us on medication, which was one of the reasons he had to be conserved. It wasn't my dream that, my son would end up on an LPS conservatorship and locked away for the majority of his life. But thankfully, as a result of him having access to CPT and having treatment, having a medication change there, finally, it gave him enough recovery and enough insight to understand his mental illness. And, I'll never forget, Mom, you know what? I have a mental illness. And I know, honey, I know. And so it was, and now, he takes 18 pills a day, including an injectable, but it's working. And it's allowed him to move for the first time from a locked facility to actually a facility in Santa Clara County, Synergy, another one of the facilities that Lauren mentioned. And so where he's lived successfully for 2 years. So it's the first, so there is hope. You know, there is hope, but it requires combining, marrying the medical model with the recovery model, not divorcing the two.
Wonderful. Yes. So as we always do, we will continue the conversation with our speakers after we finish the recording. But to finish up, all of you who have been enjoying our program, please know that there's a couple more things we'd like you to do. Please let us know you are here. There is an attendance space that is a little farther down the page, and then our discussion forum at the bottom. And we would love for you to engage in the discussion about what's possible, what we can do to make a difference in the lives of others. With that, we will hand it back to Teresa for the final word.
Well, thank you again so much for inviting us today. We are partners on this journey, and you know, as I mentioned, my son is living in Santa Clara County. I'm in Contra Costa, so I travel from Contra Costa to Santa Clara County, and I see the encampments along the freeway as I'm driving to Synergy, where my son has received the best care, the most humane care, and is succeeding, and will hopefully be allowed to move on to independence from this stay. And so I would just invite you all to, you know, share our story, share our paper. Consider joining organizations like the Hope Street Coalition. That is a new coalition of people that are coming together to challenge the status quo. And, you know, support your local family advocates, especially those that are going to stand up to people in power and say, we need to take care of this forgotten population with the forgotten families. Thank you all so much.
Thank you. And for everyone, we will see you next week.